Welcome back to our podcast today. So today, as I said from the past two interviews, we are getting politicians in our podcast, and today we have Georgie Crozier, member in the upper house in Victorian Parliament. Thank you for joining us today.
Hi, Francis. Hi, Tobias and George. Thank you for having me.
So Georgie, can you please give us like a little bit more information about yourself, like your background within other work you've had before politics, and yeah, just to give us a little bit about it. Just give us a little bit more information about yourself.
Yeah, sure. I was elected to the Victorian Parliament as a member for Southern Metropolitan Region in 2010, and I've got a bit of a mixed bag of experience prior to entering the Parliament. But for 16, 17 years, I worked in the public health space. So I've worked I'm a former nurse and a former midwife, and I've held a whole range of different roles in health as well as management. And once I left health in 2010, I then went off and consulted, had a small business. So I've got a range of experience, but I'm very passionate about health, and I'm very passionate about chronic disease and prevention of chronic disease because I've got a background in diabetes education.
Great. So we'll get started on the podcast now. So I believe, George, you have the first question to ask Georgie.
Yes, I do. So my question to you is, do you think vaccines will help slow the spread of the viruses in Victoria?
Yeah, what a great question. I think this is a really important issue. Everybody is wanting a vaccine to be developed. And quite frankly, I think that the pace of which a number of vaccines have been developed is very, very encouraging. And I've been listening and I've been watching with great interest about the various vaccines that have been developed around the world, and particularly the vaccines that we will have here in Australia. And from all accounts, it's not going to be the silver bullet to eliminate the virus, but it will help slow down the disease, and it will help slow the severity of the disease and prevent further very severe illness and even death. And that is a really positive, good thing. And that's why the vaccinations are being so widely embraced, because of what we're seeing around the world with the terrible numbers of cases in some countries.
Yep. So just to touch on that, I believe we sent an email to Greg Hunt. He couldn't make the interview. So yeah, but he was going to give us some answers. So in like the news, I've been hearing about how some of the vaccines, such as like the Oxford, some of them having a lower vitality rate, I think, for like to create herd immunity. With that, do you think like the government should think about picking more like higher herd immunity rate of vaccines, such as like I think Moderna and Pfizer, instead of one like the Oxford thing?
Yeah, so there's a number of vaccines that you're referring to. So the AstraZeneca vaccine has an efficacy rate around 62%, whereas the Pfizer and Moderna vaccines have a greater efficacy rate, so it's reported. But the problem with the Pfizer vaccine, it's my understanding that they have to be held at a very low temperatures, -70 degrees, and the transportation of that and being able to do that to Australia and around Australia could be or possibly somewhat problematic. And it is looking at, there is still some contention about the full ability of those vaccines to be providing herd immunity, whereas the AstraZeneca is, again, as I said, it's a vaccine that will assist in the severity of the disease and the assistance with preventing severe illness and death. And that's what I think we need to be looking at this point in time, and to get that rolled out as quickly as possible, especially into our vulnerable groups, into those very vulnerable groups, like our aged care facilities, like the Indigenous community, Australian and Torres Strait Islanders, who are very prone to this disease, the elderly, those with medical conditions who are immunocompromised, and then of course we want to protect those frontline healthcare workers, emergency workers, people in quarantine before anyone else. So I think that's the federal government's plan to look at all of those groups to roll out, and again, they're looking at what's happening around the world because it's only just started. People have only just started to be vaccinated around the world in the UK and the US. And I think that's entirely appropriate because of the very high numbers of the virus in those countries.
Great. So we'll get on to the next question now, which kind of also relates to the last question. So George, I think you have this question as well.
Yes, I do have a second question. So my second question is, do you believe the federal government did the right thing placing money into different types of vaccines?
Yes, I do. I think the federal government has done a tremendous job in the management of the virus, from whether the decision for shutting the international borders when they did way back in February, and putting certain aspects around the country to provide guidance. It really insulated us, and they're doing this again with putting the funding into various vaccines so that they can have that choice and they can have that ability to understand what is going. They're not putting all their eggs in one basket, so to speak. They're putting some very, very necessary investment in this vaccine across the board. And they're watching it and they're monitoring it very carefully. They're obviously speaking to international counterparts. They'll be watching this and monitoring it very closely. So I think the federal government has done a tremendous job under the leadership of Greg Hunt, the Federal Health Minister, the former Chief Medical Officer, Professor Brendan Murphy, and the current Chief Medical Officer, Paul Kelly, in providing Victorians and Australians, I should say, the clear plan that they've got and the reasons why they have invested in the way they have.
Yeah, that's great. I will get on to the third question now as well. So this is my question. Have you had communication from the federal government about the vaccine rollout?
Yeah, so I speak to, when I need to speak to the Federal Department of Health and the Federal Minister on a range of issues, and I have been constantly in contact with them over the last 12 months in relation to the COVID-19 response and the issues that Victorians have faced. Of course, we faced a horrendous situation, as you are well aware, and your community was very severely affected, actually, in terms of the numbers of people that were infected with COVID. And so I speak to them regularly, and in relation to, I don't have I'm not privy to the discussions at cabinet level or what happens at national cabinet level with the premiers, the Prime Minister and the health ministers, but I do speak to them on a regular basis in relation to getting information that I can provide to constituents, and also for my own general knowledge so that I understand what's going on.
Yeah, just to touch on that, I think the federal government's pushed the vaccine rollout 1 month earlier to February. Do you think that's a good thing as well, that they push it up 1 month earlier?
Yes, I think that now that we've seen these different strains that are coming out, the strains aren't necessarily more severe in terms of the deadliness, if I can call it that, but they're highly transmissible, the South African, the UK strain, and they're very worried about that. We can't afford to go into another lockdown here in Victoria. I don't think anybody wants to do that. You would have been homeschooled, you would have been affected for a large part, like so many people in metropolitan Melbourne, and people right across Victoria, and just the decisions of government that have impacted us all. And because of what happened with the second wave, where it did escape the hotel quarantine, and then of course the widespread, so many people's livelihoods, but tragically over 800 people lost their lives. And that is what we don't want to occur again, that widespread community transmission, because the government was unable to contact trace or unable to test and trace properly. And that's what we want to avoid. And so I think with the federal government rolling out that vaccine, it will help business, give them they'll have that security of understanding that the economy and jobs and people's workplaces will be able to be managing, not in a normal pre-COVID sense, but in a under COVID umbrella, if you like, or in the prism of COVID. But more importantly, those people, those vulnerable groups, that will be protected or protected with some degree. It's important we focus on those people that I spoke about earlier, those people with medical conditions, at Indigenous community, the frontline workers, everybody who is doing the work, they need to be protected against this new strain. And so I think bringing it forward, the federal government's decision to bring that forward and monitor and watch it very closely is the right thing to do.
Yep. So we'll get on. So then now the fourth question. Now, Tobias, I believe you're doing this question.
Yes. Where will we be able to get a vaccine in Victoria?
Well, that's the decision of the state government. They're largely responsible for the rollout of the vaccine program, is my understanding. A bit like when we have our annual flu injections. So the federal government will provide the vaccine, and then the state governments will assist with that implementation and ability for people to be able to receive it. So they will be speaking, I'm sure, with the federal government about those frontline workers and those groups that I spoke about, the vulnerable Victorians, to get the vaccine first in general practice clinics, medical clinics, perhaps some specialist clinics. Other countries are using pharmacies to assist with their vaccine programs, so that might be something that they should consider. I think it should be considered. I know that nurses are being trained up to assist in this process, so there's a lot of work being done to assist that, and I'm sure the federal government is talking to every state government about their plans of how they will be able to conduct those immunisation programs across our communities.
Yep. So we'll go on to now to the fifth question. This is not really related to the vaccines. It's more related to the state government's health response from the ongoing outbreak in New South Wales. So Tobias, I think you have the.
Yeah. How did you rate the state government health response for this outbreak in New South Wales?
Well, that's a great question, Tobias, because as we've seen, New South Wales have had outbreaks, they've had clusters. They had a range of very severe issues earlier on in the pandemic back in March. And effectively, they've been testing at very high rates, testing and follow-up and contact tracing, and they've been putting in measures to be able to manage their outbreaks and clusters. And they've done that very, very well, in my view, for the entirety of the pandemic, without shutting all of their communities down. They've managed that, localised it, and being able to track and trace and follow up and provide information, real-time information on their websites. Very specific, quite different from how Victoria managed it. Victoria didn't do all of those things, and there was a real contrast. And of course, we had the shocking circumstance of the second wave lockdown, and we couldn't take any return travellers because of the situation Victoria was. Everybody was shutting Victoria out because we were really deemed to be the pariah state because of the terrible community transmission. There was no ability to really control the virus, and New South Wales was taking tens and tens of thousands of return travellers, and they've done that successfully over all of those months where we weren't taking any. And the latest decision, where they've had the Northern Beaches breakdown, they were very measured, they were very reasonable, they were very clear, concise to the community in their response, communicating, speaking clearly to the community about what was going on, and they got a good response from the community in return. Tens and tens of thousands of new people getting tested to assist with their job of tracking and tracing. And I really think that is one of the demonstrations in the differences between how, a big populous state like New South Wales has reacted to the clusters and the outbreaks as opposed to Victoria. And I've been actually quite critical on the government's decision on New Year's Eve to slam the New South Wales border shut so quickly at 3:30 p.m. on the afternoon of New Year's Eve, when so many Victorians who were given, we were told that there were areas in New South Wales don't travel to, the red zone, Sydney, but the green zones were okay. And then all of a sudden, the government at 3:30 p.m. on New Year's Eve changed that from green effectively to red and shut people out. And they only had hours to get across the border, and it was chaotic. There was mayhem. It was actually very unreasonable and dangerous because people were panicked. Some had already started their celebrations prior to that announcement. It was dangerous for them. Some of them had been drinking and they were getting in their cars and driving, and thank goodness a catastrophe didn't occur. And the police were fantastic in monitoring and guiding people back. And so many others were also assisting in that way. So I've been highly critical of the government's knee-jerk response, and we've had a lot of confusing and conflicting advice that's ongoing. And I'm dealing with people every single day, how they're stuck over the border, they've got conflicting advice, they're in isolation. That's my job, to assist them and to continue to speak with the government to get these people home safely. So we want Victorians to return home safely. Some of them are in areas, or many of them in areas where there's never been any virus, and yet they're stuck out of Victoria. I think that has been a shocking decision by the government in terms of locking their own residents out of their own state, out of their own homes, where they could be managed much better. There was a handful of cases really in New South Wales. There was a peak of 18 on one day in that time period, whereas every other day there was less than 10. It wasn't hundreds. Of course, if it was hundreds, then a different response could be required. So I'm seeking to find out from the government, what is that advice you got? Release it to the public so that we understand why these very severe restrictions were put in place in these decisions, where it's affected tens of thousands of Victorians unnecessarily.
Yeah, just to touch on those points as well. I think with the borders shutting in that area, like there's a lot of cross-border communities such as like Wodonga and Albury, and many of them probably from like Albury and Wodonga were crossing the border to probably go see family and go see fireworks and stuff. That bit there was that was pretty unreasonable, I think, for the government to shut the border off just before New Year's, like only about 9 hours before New Year's Eve would have happened, and everyone would have been at their homes and stuff. So yeah. So we'll
Exactly,
get on
Francis.
to the
Yeah, I agree with you.
yeah. So now we'll get on to the last question, which is also a bit about a lot about the border as well. Do you believe the state government should have shut the border earlier to stop the spread of the virus into Victoria?
Well, we're not saying, I'm not saying the border shouldn't be shut if there's a very real and a threat to Victorians. We don't want another lockdown. We want the government to be providing these decisions in a consistent manner, but on the basis of what was the government's advice that they received to make that decision at 3:30 p.m. on New Year's Eve to slam the border shut. That's what I want to understand. And I think every Victorian deserves to have that information, because the government has a lot of power. As I said, we're under a continued state of emergency, but they've got a lot of power that they can make these decisions that are impacting people's lives. And as you said, Francis, like the cross-border communities, there's a lot of conflicting advice, there's a lot of confusion, there's a lot of difference in terms of how those communities operate. The government has clarified that somewhat, so the border communities are in a bubble, and that has been ongoing for some months. But at the time of New Year's Eve, there was complete and utter confusion, and there were different decisions were being made days later. So that is, we're not saying close the borders if there is a reason to, and if there was 800 cases a day in New South Wales, clearly that would have been a reason, obviously, for the government to be very prudent and act. But when there's only a handful of cases where the New South Wales Health Department had done a very good job in terms of tracking and tracing, not saying it's perfect, and no government will get it right all the time, and we understand that, we accept that they make mistakes, but we know a lot more about this virus as the year has gone on, and we know a lot more about how it can be managed. And I think there's a lot of people that have done some just terrific work around managing that and understanding the community response, the local response. You've got some tremendous GPs in your area that I've spoken with, and I speak with regularly, who really know their community, and they are part of the solution, the ongoing solution to how to manage this virus. So I don't think we need these decisions that are so arbitrary, like slamming the borders shut in the way it was done on New Year's Eve. We really need to understand in the future how government is making the decision and if they are going to close the borders again. They need to give people a greater understanding of the reasons, the advice, release that advice, give them more warning, and for goodness sake, don't do it at a time when people are starting their celebrations on New Year's Eve like they had and causing mass panic to get back to Victoria.
Yeah, just touch on that last point there as well, because I think there was a lot of videos coming in that showed like a huge line on like the border crossings and stuff, and people were getting turned back as well. So yeah.
I was getting them. I had people that I knew who were texting me and phoning me at midnight. They were stuck in queues. They were stuck in, one of my office staff was caught up in the whole thing, and she explained to me what was going on, that the children were walking on the roads, people had to go to the loo on the sides of the roads, there was no food, there was no water, petrol. You know, it was hard because everybody was trying to make the deadline at midnight, and sometimes they were coming from areas up the south east coast of New South Wales where there'd been no virus. People had gone there for their holidays, they thought it was okay. They were, you know, seeing their families after so long, being with them after being in lockdown for so long. So they were wanting to see their families again in the middle of New South Wales. And you couldn't by the time they got the news, they weren't tuned into the 3:30 press conference of the government. It might have been hours later that somebody had rang them saying, you need to get back before midnight. So it wasn't the 9 hours. For some people, it was 5 hours notice because they weren't notified. They didn't know about it. And they were 6 hours out, so they were never going to make that border closure. So there were so many issues that the government didn't think through on that one decision, which I think was a very bad decision. And I will be pursuing that because I think those people, that there was tens and tens of thousands of Victorians who were caught up in it. And there have been families separated. There have been so many people that are still stuck in New South Wales and they can't get back, or they haven't been able to get clarity about their own situation. And that's the importance of government decisions. To go back to our start of our conversation, government impacts your lives, whether it's building a new school or a new hospital or removing a level crossing, building a new road or providing police. It's these decisions too that impact people's ability to have a livelihood and to be safe. So governments are really important, and that's why we need to have a good process, a good democratic process that we can continue to question government. We play a role, the media plays a role, but more importantly, the community plays a role.
Yeah. So those are all the questions we have for you today, Georgie. I really appreciate you coming on the Zoom call with us and discussing these questions with us.
Well, it's been my pleasure, and thank you for the opportunity, and good luck with your studies. And let's hope we have you don't have to go back into remote learning, and 2021 is a much, much better year than 2020. I think I've got a great feel about it. I think it will be, and good luck with everything that you do into the future.
Yes, thank you. And thank you everyone for watching the podcast. I hope you guys enjoyed, and see you guys soon.
Okay, bye-bye.
Bye.
Bye.